We've been talking about the attitude observed, especially in the southwest, in Lagos in particular, where we're broadcasting from. The people seem to be carrying on as if COVID is a thing of the past. All the public precautions that doctors, directed at the time, very few of those are still being observed. What is your observation in Abuja? Is it any better? Are people still carrying on as if we're in a serious pandemic that nobody has said is over?
I think globally it's still a challenge. Globally it's still a challenge in terms of
Well, we can hear you,
is a challenge in terms of. Okay, thank you very much. Globally, it's still a challenge, to get people to wear the mask. But initially, I think there was that people were not sure there was COVID. And what we are seeing now and what is happening, they find that COVID is real. I heard Dr. Boye talking about, what people thought before in terms of it's not going to come to Africa, and then, people are going to because of the sun and others. But they found out that really the pandemic is here, and we're actually in the fourth wave. We might, like you talked about testing and the way we respond to health issues and most issues, but you and I know that COVID is here. We've had reports of people dying. Like you said, our reports and how we report things, I think it's culturally, people will say it's not my portion, but we have seen it, and we know close relatives who have died from COVID, so it is here. And I think with the government, through the Presidential Steering Committee, the information going out there is please, the wearing the mask, making sure that you wash your hands, and then, wear your mask, and then social distancing is important. And we have kept those advisories there. In addition, also for ceremonies and going to churches, based on our sensitization, we've continued to do that through our communication team, the risk communication team, and we sensitize people on what to do. Even within the communities, we are using our gatekeepers to tell people what to do, and making sure that they wear the mask. It might be expensive, but they can use a covering or social distancing. It is a long haul, I know, in terms of compliance, but the information is there. We're not out of the woods yet. And that is why we need to, make sure that everyone gets vaccinated. And the NPHCDA, which is an arm of government responsible for vaccination, is ramping up in the current phase, especially as we go into the season of Christmas, to see that everybody gets protected. And that is why we've commenced a mass vaccination across the country.